Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing and collagen stimulation as well. I did a lot of cool cases today. This whole week was really cool. Really great cases, really great patients. A lot of them came from the live, so you may actually see them at some point come on here. And I wanted to go through this particular case because some of my patients actually this week had forehead scars that I had to solve. And I love treating forehead scars actually. People say that they're the hardest scars to treat. Actually, I find them to be some of the best, most satisfying scars actually, because a little bit of subcision, TCA CROSS, laser, volume, it solves it really well. So I'll walk you through a bit of this case and basically just go through and answer a lot of questions and talk about some of the cases I did this week. I had two really good, very amazing patients come in for Phenol peels this week. They're here's Keep It Zen's on here right now, and she had just gotten the Phenol, and so I was just talking about that. I don't know how you're feeling right now today. You got done yesterday. We did Dermabrasion today, and always appreciate her coming on, and thank you so much for joining us. Hi, Keep It Zen. Hopefully you're doing okay. Seems like you are if you came on here. We just did it yesterday actually for her. She's an incredible person, really wonderful. And if you actually want, I could go through a bit of what you were telling me today, just about your story, your journey. So Keep It Zen saying feeling fine, no pain. So she did the Phenol peel yesterday, and today we did Dermabrasion. And it was a really great conversation with you just about just your scars, your journey with acne, and what it took really to get to this point now where you are now trying to get it so that it's as smooth as possible. You've done so many different treatments before in the past, and we did a subcision, which was like excellent response for you, like excellent. We did it last month, and it looks already really a lot better from that. And I haven't, done any volume yet, but it already looks really lifted. And then we did Phenol yesterday, so a deep Phenol peel yesterday, and today we did what's called Dermabrasion. And that means that we basically sanded down the scar tissue. So we sanded it down, and what works actually for this is that there's these thick edges of these scars, and we want to refine it a bit more. So I do Dermabrasion, but I don't use like a motorized tool with that. Actually, I want to feel the scar tissue, so I use sandpaper actually, and different tools. And I essentially want to make sure that just with my own hands, I'm in the exact layer that it needs to be at. And I made it as flat and smooth as I possibly could. And that's what we did today for Keep It Zen. Really impressive for her to come on tonight, which I appreciate. And she's saying she's feeling no pain. So actually, if you could Keep It Zen, if you could tell us how the pain was after the procedure and how it's been after the today's portion of things with the Dermabrasion, that would be really nice. Lena's asking, hi doctor, what is your take on growth factors, exosomes, and stem cells after treatment? Does it make a difference? I'm still open to it. I still want to explore it some more. I actually tried it on my own skin, and I found that it didn't really seem to make much of a difference, but I'll try different brands and see if there's anything that that could potentially be good for it with exosomes. But I haven't really seen anything that moved the needle, really. It wasn't anything that I was particularly too excited about. And I'm open to it. I always want to take a look and see, is there anything new out there? Is there hope for some way of getting a better result? But the problem is that, there's a lot of promise with these stem cells and everything. It's been around for a while now, and I just haven't seen great scar results, from it. But again, I'm open to it. Let's see here, what just happened here. Looks like my system may have froze here. Let's see. Well, if you could still hear me, that's fine. But my computer just froze completely on me. So hopefully you guys can still see me. It seems like I'm still connected. Hopefully that's great. But okay. So let's see here. Mrs. Jones is saying, hello, Dr. Qazi. Loving the result. Appreciate you so much, Mrs. Jones. Appreciate you. Thank you so much for that. And let's see here. Oh, okay. I unfroze my computer system. I was trying to put down something here for this. I was trying to say these are forehead acne scars. People are asking what this treatment was. I think they're not familiar with what I do. So I'll just put it down here for everybody. And then that was freezing and lagging everything here. But these are forehead acne scars. For those just joining, I am Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. And actually, interestingly enough, forehead scars are something I actually love to treat because it responds incredibly well. It's something that requires just some subcision, volume. In this case, we did TCA CROSS and laser as well. But it works really, really well. And you can see just over time that it gets better and better, which is awesome too. So I actually love it. It's one of those things that, like, people kind of get scared of. They think that there's just no hope. There's no way of getting that solved. But there's like a lot of improvement that you could get with forehead, really, especially because of the volume loss there. So putting a little bit of filler there, and then you could, as long as you freeze the face, make sure there's no more movement over the course of a year and a half, you retrained your face, don't get any movement. I want to kind of emphasize this because, like, you want to make sure that there's no movement if you do permanent fillers. And people will say to you, never do permanent fillers in the forehead. And, like, by the book, that's absolutely true. But, if you could freeze it and you're somebody who doesn't move much, it could work really, really well for patients. And there's ways of doing it in small select spots if you're really, really careful in certain areas. And, there's a patient that had like a little scar up over here today that I worked on, and I did some Bellifold over there. And I've been working on him just slowly, very, very slow, little bits of it. And it looks almost completely flat right now at this point. So it's awesome. Oh, thanks so much, Lucky Singh. So Keep It Zen, who did a Phenol yesterday, is saying that she hasn't even taken the pain meds because she hasn't needed to. I didn't expect that, actually. Pleasant surprise, though. That's awesome. Yeah, it's surprisingly not painful, but I do want people to have help when they do the Phenol. And I know your mom's helping you out with yours, and that's really, really helpful for you. Coco's saying, oh, good seeing you on here. Coco's on here saying, how long do Phenol peels take? Well, it takes about an hour total for the first day, and then the next day you come in again for another hour session, basically, of dermabrasion. And what I mean by that, and you said that no way do we use sandpaper. Yes, we do use some sandpaper, sterile sandpaper, other sterile tools that we'll use just to sand down the skin. And that's really important because I want to get down to a deeper layer the next day. And with scars, there's still some thick edges there, so I want to get it completely smooth. And we can do that really, really beautifully well with the Phenol. It's like the one thing that I really enjoy with it is that you can really see the layers of skin very, very easily, and you can just get to exactly what you need to smooth it down. Thanks so much, again, Mrs. Jones. Appreciate you so much. You're always so supportive. Maria is asking about Pico laser. Does that help with ice pick scars? That's actually one kind of scars actually it does help with pretty well. And the reason why is because it actually helps shrink pores a bit there because it helps with oil production. And you do find sometimes that even with actual true scars itself, that the diameter of the scar shrinks a bit. There's more collagen production as well. So yes, it is something that does help with scars. PK Farnsworth, PK, how are you doing? Thank you for this case tonight. Are providers trained to always place fillers on the right side of a patient's first face? Is it due to provider handedness? My volume loss is greater on the left. Not necessarily, no. I don't know if there's necessarily a preference for people. It sort of depends on like the position of the patient or what you're seeing. Not necessarily that people normally go to the right. I don't know. But there's some people that, I've seen some doctors that they say that they can't use their left hand, so they do have a trouble with their left hand. But so fortunately, I'm ambidextrous, so I could do both hands, and it's okay. But it takes a while to balance skin, especially when there's fat loss and volume loss. It's like a slow process, and everyone, of course, has asymmetry when you're in the womb, when your embryo is forming, you're continuously growing. Your one side of your skull is growing faster than the other side, and so you'll see that one side is a little bit higher than the other side. This is absolutely normal for everybody. Let's see here. User 44 is saying, I went to see a specialist and it looks like I need a subcision treatment first before scar treatment. Do you do both subcision and scar treatments? Yes, a lot of times I do it on the same day, but it sounds like they are preferring to do subcision first, and that's totally fine if they want to do it that way. There's multiple different ways of doing it. As long as they're doing it safely, they're getting to a great result. I think it's gonna be awesome for you. Let's see here. Linda is saying, "Hi, Dr. Qazi, I have similar scars as your client at my forehead. Which treatments can help with this problem?" Good question. I mean, this was with TCA CROSS. This was with Subcision. This is with volume replacement where we did some filler. And then we also actually did laser as well. So we did a few different steps there to be able to achieve this there. And we started to do some Botox now, Dysport in this case, and that's just going to relax the muscle so we could then be able to do more permanent products as well. I just want to really retrain his face, and we'll get continuous improvement there. Pretty Face Jenny is saying, "Can you help my face?" I love the positivity there that you call yourself pretty Face and you're trying to, I guess, optimize a bit more. I absolutely could try to help you out with that. I would absolutely love to be able to help you with that. Maxwell Thomas is saying, "I think your work is so good, Doc. I need help with some work. I will be happy to help you. Just schedule a consultation just directly on our page at drqazi.com, and we'll be happy to help you." PK Farnsworth is saying that they're ambidextrous too, and so I love that. I love the fact, it's actually anybody in this industry, anybody that's like just doing things that like involves your hands, try to teach yourself how to use both hands. I don't know why we're so like forced to like be dominant in one hand only. Like everyone just says just only use that hand. It's actually like really, really useful as a skill set to just be able to just interchange it, So just something to consider, because like if you're somebody that's doing things like manually, try to do it both hands. Rachel is saying, "Do you work on surgical scars on the face?" Yes, absolutely. Actually, today's patient, actually two of my patients had facelift scars today, and I worked on that as well. So absolutely, I do that. Do laser facials really help? They could, yeah, they could be awesome. Just like low level, low heat lasers, more for like texture, not so much for scars, but like as a quick little pick me up for texture. It's awesome for that. But it depends on, what kind of skin type you have, if it's necessarily appropriate. Hang on a second. My dog's eating something. One second. Oh, she's eating her stick. Never mind. That's good. Okay. She's allowed to eat that one. That was her chew stick. She grabbed that for herself. Okay, so where was I at there? I missed a bunch of things. Do you recommend getting Dysport, Botox before getting treatments? Yeah, that's a great option, especially if we're doing your forehead. Get it done beforehand and relax it. I mean, I could do it, of course, for you, but we want that relaxed, and then retrain your forehead. If you're interested in it, like there's a way to actually retrain your muscles. And I actually don't even do Botox on my forehead. I just don't have movement there. I just trained it a long time ago. And it's really cool. You should see. Just try to do it. And you'll see that like it really does help out with your scars. It'll help out with your wrinkles a lot more. I'm trying to make sure that like this part also just kind of gets a little more frozen for myself too. But it's really great if you have scars. It'll remodel and restructure those. And, a lot of people will say to you that it's just not possible. Like you just have to just like live with these things. But like, it's actually a lot of stuff is a lot more possible than people say, honestly. A lot of things are actually just really a lot more possible. And it's like people just are so limited sometimes because, around us, there's people that just are just pessimistic and just view it as just, this is the world. This is how it is. We just had to go along with it and just like la-di-da. Nothing I could do about it. Nothing we could do. We can't solve anything. Just gotta just like make money and just move on. And like, it's just like, this is why like things just aren't working out, because it's like everybody just has this mindset, and nobody, well, not nobody, there's a lot of people, but like there's a lot of people out there that just don't want to advance things, don't want to move things, don't want to make things better. And we're like trapped we've been trapped for a long time in so many different fields, in so many different parts of the world for science and for medicine. And it's like time to just like knock it over really. So I'll just tell you that like a lot of stuff is more possible than they say. Silicone tape works. I don't know why I saw some plastic surgeon on here and they're talking about silicone tape not working. And it's like, dude, it's awesome. It's great. I don't know what you're talking, like, I don't know sometimes what they're referring to, what they're saying. And, instead they're talking about doing like microneedling for scars or something like that. And it was like, they had like that trend, all these TikTok trends, like in between, like honestly, my feed sometimes is like a Gazan begging for like mercy, begging for like help. And then like another Gazan, like having to do like a battle, like some sort of battle that they have to do in order to make some money to survive for their family. And then the next thing on my feed will be like a plastic surgeon or someone like making a statement that like microneedling is like a 10 out of 10 for scars or something like that. And so sometimes I don't even like to scroll actually anymore, because it's like I mean, I do like to help out the people that are asking for help there, but like these other things are just like, it's sort of frustrating. You look through this over and over and it's like, what is this now? And then someone else is like a QVC doctor just like selling something of like some nonsense thing that they're saying is going to cure something. And that's what we're seeing on our like my For You page. I don't know, maybe it's just my For You page, I don't know, but like that's what I see on my thing all the time. What do you think about saline injections? It depends. If it's more for like scar tissue and you want to break it up a bit, that's of course useful when we do subcision. Part of it is with saline, but we do it with lidocaine and epinephrine too. But it's not necessarily going to be like by itself for much. How far are you from downtown LA? I don't know. I mean, I'm not sure what it says on map, but it's like usually it's probably like 45 minutes to an hour or so. Let's see here. Dr. Qazi, please answer my question. I waited and asked so many times. Sad face, sad face, sad face. Actually, I don't see your question on here, so I'm not sure what happened with that, but feel free to, I see it on all the way up there. Between PicoGenesis sessions on the body, should we use hydroquinone 4%? That's a good question. I mean, let's talk to your practitioner. Actually, hydroquinone sometimes could lead to hypopigmentation, so be really, really careful. It could lead to hypopigmentation, so that's one thing, and then you don't want to do it for too long, so it may need some other options there. Ray is saying, if I have volume loss but it's not tethered, will CO2 laser help? How do you know it's not tethered? I don't know. I'm not sure if it really truly is not tethered. Usually there's some sort of tether bonds. I'm not sure. Are you really sure that's not tethered? I'm not sure. Because if it is the case, that's different. But like double check, because it's really unusual if you have volume loss and it's not tethered. Hi, Alan. How's it going? Good seeing you on. Let's see here. Bianca is saying that they're 42 years old and they've never had Botox. Can it be dangerous? Well, if it's done properly, it's very, very excellent. Even if it's not done well, it gets out of your system in 3.5 to 4 months. So, it's not like a permanent damage there, and you could retrain your face and retrain yourself to it's kind of not move as much, and it works out really, really well for that. So it's something to consider. I see here Alex Carter saying, last night you said you use different TCA strengths depending on the scar depth and whether it is used on the base or the walls. What is the lowest and strongest percentage TCA you use? Well, I don't go specifically for people because I don't want them just to experiment at home, but it's from 30 to 90%. So it ranges just again depending on the depth of the scar and if I'm going in inside walls or not. Sometimes even like I want to soften the edges of these scars too, so I use a different concentration for that. And sometimes after laser, like today's case was really severe deep ice pick scars, so after the laser I go back and did more TCA there and I use a different concentration. Alex Carter is saying, I have a very deep ice pick hole in my forehead where it's a dark hole, you cannot see the bottom. Is that fixable with TCA, or is it too deep in the dermis to get response and doesn't need excision? Because I want to avoid excision if possible. Okay, so Alex, take a look. I mean, I don't know if you have movement on your forehead or not. First of all, you should try to freeze it when you have a scar. But if you have movement, try to see where is that scar? Is it exactly on the line? So if it's on the line, that could potentially be a spot that you could end up excising. I did a case, I talked about her about a month ago or so, about maybe 6 weeks ago or so. She sometimes comes on here. She's all the way from Montreal. She has cancer, stage 3 cancer, and she came all the way over just so she could feel a lot better in life. And I did excisions on her forehead because they were exactly where I needed it to be. And now 6 weeks out, they're almost invisible. That's what she was telling me. You look at it like it's almost invisible from photos. And so it works incredibly well. So TCA CROSS works very, very well. But when I can excise, I try to excise. If it's something that we could excise and I think it's safe enough to excise, I do try to. It just depends on what we're seeing there. So you keep it sending saying that she has done subcisions in the past with other doctors. What Dr. Qazi did was next level, didn't even seem like the same procedure. Results were better than all my other ones combined. Food for thought. Thank you so much. That's so nice. That is so very nice of you. Thank you so much for that. I appreciate you. That was a really, really nice comment. Manuela saying, but it took many treatments. Sometimes I did TCA CROSS with Dermapen and combined with Alma hybrid laser, and it worked against my scars. Oh, so it sounds like it made the scars worse. Is that what you're saying? Understanding saying, I have a keloid from an upper lip lift. Is it possible to get rid of it? It may not truly be a full keloid over there. It may just be hypertrophic scar. And yes, you could soften that up. You can actually help it so that it reduces. What causes the ice pick and boxcar scars with some people and not others? That's a good question. It's really okay. So it's kind of funny. But there's a lot of people get focused and fixated on scars, and of course I try to pay attention to these things. But there's a lot of scars that could get combined. You know, like you could have a couple ice pick scars together and it becomes a boxcar scar. Sometimes if you're doing something like potentially like microneedling, for example, it widens the scar and becomes a boxcar scar. Sometimes it's in a spot where because there's a little bit of tethering with all scars on the face, and you're smiling and animating, and it's stuck and pulled, and now slowly over time it becomes a rolling scar. That boxcar scar becomes more of a rolling scar now. So it's more like, it's not exactly like this, this clear like delineation. It's more like a spectrum, and like a lot of things in life, actually, a lot of things actually turn out to be more of a spectrum than people expect. It's like, oh, it's like either this or that, but maybe there's like some variables, and maybe there's someone that doesn't really quite fit into this. It's like all these people are like so obsessed with like, gender identity and everything like that, and like intersex exists, like it exists, like in biologically it's like a fact of life. The intersex people exist, and like you tell that to people and they just like, people that are like so against this, and it's like they just like their mind just doesn't know how to comprehend this. Like intersex exists. It's like it actually is something where people can get phenotypically their genitals will not fit their chromosomes, and it's like their mind just gets blown. And like, how do they explain it? What do they say to do? Where do they go? Nobody has any explanation for it. So it's like a lot of stuff is a lot more of a spectrum than people think. It's like just like, relax about a lot of things. And even with scars, like don't like worry too much about it. There's a way to treat each of these things. There's a way to solve it, but it's not quite as like rigid as you may think. And that's where you can be like, that's what I like, because it's like allows for a lot more creativity, a lot more like problem solving, and like it's a lot more like just logically like it's just like this is a really cool complex situation here, and let's see all the different things that we see on the skin and we're feeling and touching. How are we going to solve this problem now? And it's like three-dimensionally in front of you, and it's really unique to be able to do that. So I love the fact that it is actually like that. I think that's what's so cool about so many different things, that there's so many different variables, and like these absolutes that are out there are just so problematic. It's like just people just make this thing like it just has to be this way, and it's like no, it's like there's like variables in scars. Let's see here, 2016. I did subcision scars. They lifted, but scars still pigmented. And let's see here. What was the question? Oh, well, I guess you're just saying the scar is still pigmented. Are you saying like it's red or it's brown? And I guess I'm missing that. Sailor Moon saying, you're amazing, Dr. Qazi. No one else has this approach and demeanor. Appreciate you. Thank you so much. And I think more people are you're going to start seeing that there are a lot of people out there, though. There's certainly, though, there's no question. And I've talked about it many times. There's a lot of people in medicine that are, unfortunately, even though that they like really sometimes don't even come from like a wealthy background or so, they really do view themselves as if they're just in a different class from everybody else, and think that they're like this ruling class and they deserve to be in the ruling class and they should talk to people a certain way. One of my patients today, it was a really sad story, actually, a really sad story. She came all the way from Fresno. She said that she was on Medi-Cal and didn't have access to dermatologists, and by the time she got to a dermatologist, the dermatologist was extremely rude to her, hardly looked at her, hardly examined her, and really was just very dismissive of her scars, and said that she just had, like, she told her to her face, and she was like a young girl. She said she was she was a teenager, and she said that, wow, you just have real big pits in your face or so, something like that nature. And think about that. Like, I mean, that's just, it's totally outrageous when you actually think of it, like you say it out loud like that. But on my side of things, as when I was a student, when I was a resident, I did hear people say those things. And you know what they said it to? You know what they would actually legitimately say after that or before that? It was like, oh, she's just a Medi-Cal, Medicaid type of person. and they'll roll their eyes. They think that we're never hardly getting paid for this anyways, blah, blah, blah. And that's how they basically will treat the patient. I'm not saying this is like a widespread thing from like, or just like it's only just in the dermatology world, but it's there. And, you know, it's like even in like a public hospital, like Cook County Hospital, there's a situation where, you know, one of there's many situations, but one patient I remember was really, really clear that we had a girl who got burned. She got like trapped actually between the radiator and her bed, and she got severely burned. And the surgeon was just like yelling at the mom about the fact that like, why was the radiator on? He didn't understand what a radiator was. He didn't understand that like you need a radiator in Chicago in like certain apartment buildings and stuff like that. And there's no central heat. And it's like, it's so far behind like the stuff that they say that they don't understand. And it's like, it's so terrible the way that they view this stuff. And they just are blaming, they're blaming patients. They're blaming this mom whose little girl just got burned and severe burns. And they're blaming her for having a radiator on in a Chicago winter. And it's like, of all the things and of all the issues, and like the only reason why he did that, only reason why he thought he could get away with that is because the patient was black and she was poor. That's the reason why she did that. That's the reason why this happened. You know, that's exactly, and he couldn't even like put himself in these shoes and understand that this was a situation that was terrible and that there's a lot of different issues involved here. And it's not because, you know, the mom was just like putting a radiator on for fun. Like that's the last thing that was happening in this situation. So there's a lot of that in all this aspect. So people are saying, you know, I didn't get results and from like previous doctors, and like I've done to this things and that. It's terrible. And you know, we see it over and over and over again that's the case. That's just unfortunate. That's the situation as it is. And what happens though is that people get out of that part and they sort of just now think that, hey, this is the way the world is supposed to be. This is how it is. I can't change it. I'm just going to continue doing this. I'm going to be exactly how they were towards me, and I'm going to do that to the next generation or the next the people that are a little bit lower on the ladder than me. And it's just like that. That's exactly how it just continues to go. This cycle continues to happen, and that's why we're look around this world today. Do you think it's better today than it was 20 years ago? Is it better than it was 30 years ago, 40 years ago, 50 years ago? Is it really actually better? Like, we got better technology, but like, is service better? Is anything else better with this stuff? It's just, there's a lot of this stuff. There's a lot of issues that like people are having that are there. Once they get a little bit of money, they're viewing themselves as suddenly they're in a different class now. They're like, oh, I have a little bit of money and now I can look down on other people. And it's, it's terrible. I think it's a really, really terrible situation there that hopefully everybody on here understands. It seems like all the patients that came in today that I was working on today, they really, really, really understood this whole process. And it was really like, they got it. They got what's the struggle is, and they understand it. They understand why this needs to change, and they're doing this for themselves so that they can feel a lot better about it. And Keep It Sun is on here, and she was telling me about basically her journey, where really she had a really terrible trauma, terrible scars, and she remembers like picking at this one scar I was working on today for her, and she's just saying that like she saw it was white in the inside there. She thought it was pus, and basically squeezed it a bit, and then it seemed like it scarred more. And she just wanted that scar particularly really improve a lot more. And it's like, I did it, it's going to be really, really nice and smooth, because she's saying that every time she looks at herself in the mirror, she's reminded of that. She's reminded of that, and she feels bad about it. She feels bad about the situation that happened there. But I do think, honestly, I want everybody to remember this though, like that there's a lot of people out there, a lot of my own patients, they never pick their skin. And there's also people that do pick their skin and they don't scar. There's a lot that's involved that we don't necessarily know every aspect of. Some of it's just due to tension. Some of it's due to genetics. Some of it's due to just like many tensions, like how the scars are being pulled around your skin. But some of it's just like luck. There's a lot of different factors involved in it. So it's like, you can't like beat yourself up about it. You can't be upset like, oh, my parents didn't go to the dermatologist in time. My parents, what we were talking about earlier, one of the patients earlier she's saying that she was a little bit upset that her parents couldn't take her or told her sort of the wrong techniques to remove some of the acne on there, and it caused more scarring. But the issue isn't that your parents told you the wrong treatment for the acne. The issue is actually that you didn't have access to high-level physicians. You didn't have access to it, and the physicians you did go to, like that person that ended up going to a dermatologist, and it was terrible for her, and the dermatologist was commenting on her skin and basically dismissive and hardly touched her, and she's was a Medi-Cal patient, and it's like that stuff is that's the stuff to be upset about. Don't be upset with your parents. Don't be upset with yourself for like touching your skin. Don't touch it. Don't pick it. But like, don't be upset with it at this point. Be upset with like the fact that you couldn't get access to properly high quality care, and be upset with the fact that like this should have been a lot more advanced than it is right now. You know, we pushed it now. We got a higher level now. We're going to continue to evolve, continue to get better and better, but it needed to get better a long, long time ago. It should have been better decades ago, and it's so far behind. So that's what you should be upset with. You should be upset with that part. Don't get like bogged down in like some sort of thing with like, you know, it's this person, just like this level of the doctor or someone else. And even these doctors that you're upset with, they're also part of the same problem, this same issue. Like, not meaning that they're responsible for the problem. I mean that they also are victims of the same situation. Really, a lot of physicians are victims of the same situation that you are thinking about, the access to medicine, access to care. I myself, when I go to physicians, it's actually difficult. It's difficult to go through this. It's difficult to go through all those type of things, the dentist, all that stuff. Access is garbage. And it's like, no matter where we are, we kind of recognize that, and we should realize that. And it's like, even if you're a physician, you're a dermatologist, and you're like now bought out, you're going along your life, and then suddenly your owner just sells your group to a private equity group, and now suddenly it's like everything is just changed, everything is shifted, and you now have to see from 30 patients a day to 60 patients a day, and now imagine the quality of care that you're going to be able to provide to patients. It's hardly going to be anything. So there's really a lot of problems with this that like I think that we have to actually kind of focus a bit on that instead of being particularly upset with like the smaller issue or the more direct person, which is like your parents or yourself or anything like that. Think of this bigger issue to be upset with. Don't focus on that. Don't focus on any of those little things. Name of the treatment for this is actually just, I don't have a name. People say combo for like with a Q, but this was a few different things. This was with Subcision, this is with TCA CROSS, this is with laser and volume. And so a few different steps there. I did do volume a couple times. Oh, hi Thailand. How's it going with you too? Thanks so much for coming on. Shruti is saying, here I can't find any acne scar treatments. I see most of my patients coming from out of state, so I'll be happy to help you when you're ready. I'll be happy to help you with that. So it's very, very possible for us to help no matter where you are. There's another patient on here asking about why is microneedling bad? So it's a good question. Actually, yesterday, one of my patients was also explaining about her scars. She had ice pick and boxcar scars, and she found that her scars got worse due to microneedling. The reason why is because sometimes people go a little bit too aggressive with it in order to make it more effective, and it can widen scars. So that's why I don't recommend it. It could also cause post-inflammatory hyperpigmentation. Typically, it doesn't help too much with these kind of scars. It's very, very mild, if anything. It's like very mild, collagen response. It does make the skin itself look a little bit better, but it's pretty mild. And so, just something to pay attention to, that microneedling, and hopefully it doesn't cause it to get worse, but sometimes it just doesn't, or I should say most times, it just doesn't even help at all. JJ is asking, how far out should an appointment for acne scar treatment be made time-wise? That's a good question. I mean, we're booked up pretty well, but the fall time gets really busy. So I always try to put more people on there as I could and see as many people as I can. There's a lot of work that I want to do and a lot of people I want to solve. And so feel free just to go to drqazi.com. You'll schedule a consultation. And then, by the way, the consultation fee gets applied towards a treatment. So feel free to do that. Sharon Pizarro is asking, how do we book a treatment? Go to drqazi.com and schedule a consultation that way. Let's see here. Do you treat all types of scars? Yes, all types of scars. I treat all types of scars. And so I will be happy to help you. And if they need really a situation, or if you need something like really more surgical, like let's say you're talking about like a tummy tuck scar and we have to do a revision, my partner does that. She is amazing at that. She'll be very, very happy to do that. Thailand, you and Keep It Zen should talk. Actually, I think you guys would. Thailand, I think you'll see that kind of a similar journey, similar pathway actually, and it's really, really interesting actually. How many people? I was telling you that before, but it's really interesting how many people have gone through the same type of issue, see the same type of problems, and understand it really well actually. It's sort of interesting, actually. This week, I had a interesting situation where I had two patients who were going through miscarriages and thinking about like the IVF world and so. And that also is like a smaller world than people may realize, and it's more supportive than people may realize. And then another patient today who was talking about how she has a special needs son and how they have a community of people that really, really helped for parents who have who have kids with special needs, and it's like so supportive and so helpful for her. So it's like that's actually what we need, really. This in order to counter everything in this world, we just need more communities that are just like small communities like that, and that are just like that we could trust and that are tight, and and find those wherever they are, and just like as long as they're supportive and good for you. Just try to find those, because I think it's going to be awesome. It really does get people through really, really dark times too. Let's see where I was. By the way, PK, good seeing you on again, by the way. Let's see here. Where was I at? I did Accutane 6 years ago, cleared my skin, and now I still break out. So maybe you just need to control the bacterial component of it. It's possible, but it's possible you also need Accutane again. The hormones can fluctuate, and I don't know if you're like somebody who drinks a lot of milk or anything like that, or a lot of patients right now are doing like whey protein, which really could trigger acne. Actually, I don't know if you're on right now. I don't. I'll just say, well, Mike, if you are on, you were mentioning a particular protein that people could drink that doesn't trigger acne. You found he's like a bodybuilder patient of mine. He was saying there's a protein drink. He says like pea or something like that. It's like a pea protein. I don't know how good it is, but that's what he was saying. But don't drink dairy as much as you do. Try to cut it out completely if you have acne-prone skin. Really, really consider that. Really cut out dairy. Does constant picking of skin increase the chance of cancer? I haven't heard anything about cancer, but it could cause more with pigmentation and scarring. Yes, it could do that. When you ask if an excision is on a line, when I raise my eyebrows, the hole is exactly on a wrinkle line. Do you do punch or elliptical excision, and do you use stitches or not for an ice pick excision? Ice pick, depends on the diameter of it, but typically ice pick is going to be like 1 millimeter smaller, so you do not need to use a suture for that. It actually could potentially cause more tension, but along the line like that, you potentially could do an excision then. Possible. We'll have to take a look. So schedule a consultation, or we just do the serial TCA CROSS. If I find that there's like too much tension or so too there, I may just recommend TCA CROSS until we get it so it's more superficial, and then do laser there. Kylan's saying it's really nice to not feel alone in the small world around mental illness. Body dysmorphia is tough. It is tough, but there is a way to get out of it. Like, it's like just because somebody has body dysmorphia at one point in their life doesn't mean they have to have body dysmorphia for the rest of their life, if that makes sense. Actually, right on here, Keep It Zen was essentially talking about how she just used to constantly obsess about her skin, her acne, was looking at her face over and over and over again, and was spending so much time on really in the washroom just looking at her skin that people were getting really concerned about that and were mentioning that. And I thought that was interesting, because that actually, I used to do the same thing. I used to do the same thing. I used to just look at my skin over and over and over again, and just looking and thinking, is this going to scar? Is this going to lead to something? And I would look at this and obsess with it. And sometimes I did pop things, because I would look at it like that. Maybe it'll rush it. I have to go out, and I'll be worried. I'll be worried that like if I go out, it'll be noticeable. People will see it. And so I did sometimes do that stuff, and I'll just keep on looking. And then sometimes when I was like out with friends or so, I just kept on going to the washroom to see if it was like visible in the lighting that they had or so at like wherever I was at. And I kept on like obsessed with it. But it wasn't like this permanent condition. It wasn't. I do think that we really there was ways I probably should have dealt with it healthier, and there's a lot of things that should have been done to work on that. But it ended up not being like a permanent issue that like I constantly have to worry about in the future. So like, just because somebody like, I don't believe that. I don't like, just like, there's a lot of people say, just never treat anybody with body dysmorphia. Don't do it, blah, blah, blah. And it's like, I had that, like I did feel like constantly obsessive about my skin and was constantly looking at it and seeing like how to fix it, because I was really disturbed about the fact that I had like all these massive zits on my face that were, I thought, the worst, like, the worst of my school, the worst of my friends groups. And so I was looking at this, that like, this is very obvious and visible and everybody's just going to notice this. And I was just like, I was telling actually Keep It Sun's on here today, but I was saying though that it did help me study more. It did actually. And one little positive thing is because people would go out or hang out with friends or like hang out at like the dorm rooms and stuff like that. I sometimes just didn't even feel like doing it because of my acne. I just didn't feel like it. I was just like, my skin just looks bad today. I don't feel like it. Or like, it's just like, or sometimes it looked like hurt and I would just be like itchy. And I didn't know how to like solve it. I just had like so many different skincare products, like everything in the world. And I would try so many different things to try to solve it. And it was like, just like, I'm just going to study instead. So I'll just go to the library and study. So I guess that's partly why like I ended up getting to where I got to, because I would go to the library and then like, I'll be like doing like my work and then I'll just like read random books there. So, so lots of, Miss Maria is saying lots of canceled plans. So it was something like that. Really. It was, lots of canceled plans. And I'm not saying to do that though. Like, I do think you should just, even like if you were suffering or if you are suffering from acne, still like view, like hopefully you have a supportive friends group, which is okay. And they're going to be fine with you. They're going to be cool and they're not going to bother you or harass you about it. But, if you're like somebody who like is like stuck in that world where you don't really have a great friends group, or you feel like there's just a lot of pressure to look really good in the world and like it's really tough and it feels like kind of brings you down, then maybe you gotta do what like I did. I'm not saying it's like the best thing and maybe it's not, but like I just went and like studied and like just did a lot of that and just like kind of focused on like how to get better in the world and how to like think about like ways to make the world better. And I just worked on that, honestly, and it really was really useful for me. And maybe that's something that you could take out of that, because like if you can't do it, if you feel like you just can't go out, honestly, it's better than like just sitting there. Like, I know that like people like to watch TV, things like that, or play games, but there's like so much to learn out there. There's like so many things. There's so many like cool things out there. And it's like, it's all at our fingertips, and it's like, just like incredible, like open, and like really like just like look at it and see maybe like you're like, this is like your opportunity. If you're feeling like you're too down to like go out because of your acne or scars, just look at it and see that like maybe like there's like a whole world that you want to learn and like and read about, and like you could learn a new skill set, and it's like it'll be really fun and your brain expands, and like that's gonna be like live with you for the rest of your life. Like I remember everyone said like, oh, like all these like things that I was reading like comic books and stuff like that. And honestly, to this day, I like some of the stuff that was like 30 years ago is like realistic right now today. And it's like, it's pretty cool. Like, I feel like I'm pretty well versed in this world today, because it's like, look at this Elon and like Trump fight. This is like straight out of like a WWE like episode. It's like, what the heck is going on right now? And like, it's kind of cool that like you could connect a lot of few things with, whatever you read back in the day. And so if you feel like you have to stay in, like at least do something meaningful, like read or like, or expand your mind with like some sort of skill set from these LLMs. Yeah, that is a silver lining. Let's see. I will kind of wrap up tonight, but I want to finish up with this one. This is a really nice comment that Sailor Moon is saying. She's saying, I miss so many events and opportunities with my job because I would be embarrassed about my skin. You really changed my life, doctor. I appreciate you so much. Thank you so much, Sailor Moon. That's really kind of you. And coming all the way from Arizona, I really thank you so much for coming on all the time too. And it's really nice. You basically are giving back to the community that you're a part of. It's really sweet of you to do that. Thank you so much. Alex is saying, just did CO2, TCA, and subcision, but see no improvement on the forehead. Can I do another round? You could, but most likely you may need that, but you may need volume replacement, because a little bit of scar tissue over there destroys fat. So you may need a little bit of volume there. Thank you guys so much. I will be back on Monday, actually. Today's Thursday, so I'll be back on Monday. I will see you then. Although I'm thinking, just as a heads up, I'm thinking about doing Tuesday, Thursdays. I'll let you know when I start doing that, just for a period of time. But I may end up doing like Tuesday, Thursday only.